Can you give me your name and date of birth?
Yeah, my name's Alex Reyes, and I'm 898.
Okay. Alex, can you tell me why you're here today?
I'm painting my leg.
You have pain in your leg?
Yes.
Okay, which leg is hurting? Can you
My
point
left.
to it? Your left?
Actually, my knee.
And
My
your
left
knee?
yes.
Okay. Have you had a recent injury or fall?
No,
No? Okay. On a 0 to 10 scale, can you tell me how bad that pain
it's
is?
like a 4.
Okay, is there any redness or swelling going on? Have you taken anything for the pain? Advil? When's the last time you took it?
This morning.
Okay, so it's been a few hours, and has the pain increased or decreased since you've taken it? No, it's kind of just hanging out there. So we'll do an assessment on that and make sure that we check it out pretty well. Is there any other, things that I need to know before we get started? Okay, so, I do have a couple questions I do wanna ask you. Where are you at?
The hospital.
Okay, and what's today's date?
February 28th, I think.
Okay, all right, so she's able to give me person, place, time, and situation, so A&O times 4, speech is clear and appropriate. I see that you are well groomed, looks nice and clean, appropriately dressed for the weather, have no concerns about affect, everything looks good so far, okay. The next thing we are going to do is provide for privacy. Are you comfortable?
Yes.
Okay, good. I'm also going to start, at the skin level, so I'm gonna just do an inspection, okay? And Alex, right now, I see that your skin is clear and, it is intact. I don't see any redness or any rashes going on. I would look at the extremities, make sure no redness around the knee or anything, no swelling. Is it okay if I touch you?
Yeah.
Okay. So yes, Jen. I'm just gonna use the back of my hand and check for skin temperature, both sides. And Alex's skin is kind of warm, okay? So you haven't run a fever recently, have you? Okay, all right, and now I'm gonna just do some skin tutor here. It bounces back really quick, so I'm not worried about that. While I'm at your fingers, I'm just gonna do cap refill, okay? Good, and that's less than 3 seconds also. So temperature, tutor looks good, texture looks good for all 4 extremities. Now I'm gonna do your head, face, and do some assessment tests with you. Is it okay? All right. So on inspection, if I was describing head, it is normal cephalic, so within normal shape and size. I don't see any deformities in bony structure, no edema around the orbital areas of the eye, the ears, the lips, all skin is intact. Now, I'm gonna put my gloves on before I touch you again, since I didn't do it the first time, that'll mark me off. And I'm just gonna palpate your head for tenderness, okay? Any deformities, no deformities, any pain or tenderness? No? Okay. And her hair is well distributed, the color is a light brown mixture, so it looks nice, okay? The next thing I'm gonna do, since I've already inspected her ears, and I know that there's no redness, edema, or lesions on those, I am gonna palpate any pain or tenderness. Okay? Any pain or tenderness? Alright, and looking at the face, again, no pain, tenderness. Okay, so I'm gonna start with her eyes and work my way down, okay? And on inspection, Alex has nice distributed eyebrows and eyelashes. I do not see any sparseness or missing hair going on. The sclera of the eye is clear and white. Pupils are a brown color, and I would say probably a about a 6 right now for the size of the pupils, so, and they're equal and round, okay? So pupils are equal, round, size 6. Let's see if they're reactive. Okay, so I want you to look over my shoulder here. Okay, pupils are brisk to reaction of light, so no concerns there. The next thing I'm gonna do is look for convergence, so I'm gonna have you follow the pen. We're gonna do accommodation here, okay? And it's gonna come in towards you. Okay, pupils are reactive to near constriction and far dilation, so they act appropriately. Accommodation is intact. We're gonna now check your ocular muscles, okay? So as I'm here, I wanna have you follow my pen. Now you can either do the H or the star, okay? I always do the star, so I'm just gonna have you follow. And I'm looking for nystagmus or tremor. Okay. Any pain or discomfort when I do this? No. Okay. You're smiling because I saw it. Okay, so pupils are equal, round, reactive to light and accommodation. She does have a bit of tremor to the left angle here. Nothing major. Do you wear contacts or eyeglasses?
I do not wear glasses, yeah, no contacts.
Okay. And do you have them with you today? Okay. When we go to do the eye stuff, if I was gonna use visual acuity, I would require my patient to have their eyeglasses on or their contact lenses in, okay? We're gonna do confrontation next, okay? To get that out of the way, so, yeah, I'm gonna have you cover one eye for me, okay? And I'm gonna hold some fingers up, and I want you to look right here and tell me how many fingers I'm holding up. One. Okay, alright, right here. Alright, right here. You got it?
I'm nervous.
You're good, okay?
Okay.
Good job, okay.
1, 2, 3.
Okay, now. She's looking. Okay, cover your other eye for me. Okay, this is it, this is the thing, you have to keep them focused, okay, so on my nose, okay?
2, 1, 2, 2.
Perfect, nicely done. So it is her left eye, so OS is a little weaker, okay, and she's showing some deficits there, but her peripheral vision is intact, she's able to see. Another way that you can check for peripheral vision is, I'm gonna have you stand up for me. And turn around. I'm gonna have her, okay, so, yeah, turn around. There you go. I'm gonna have her tell me when she sees my fingers, okay? So you can either do the confrontation or do this one, all right? So let me know when you see my fingers.
See them.
Wow.
Dang.
Okay, nicely done. All right, okay, go ahead and have a seat. So, eyes, so we have checked the cranial nerve 2 optic, cranial nerve 3 ocular motor, cranial nerve 4 trochlear, cranial nerve 6 adducens. They're all intact, okay? No worries there. The next thing I'm gonna do is move down to her nose, okay? The bridge of the nose is midline. I do not see any deviations, any lesions on the skin tissue, external skin tissue, and no edema. I'm gonna have you look up for me. Okay, and I'm gonna just take a check here. And she has a slight septal deviation, not major, so it's a little slight septal deviation that I am noting. And then I'm gonna look at the mirror, so I'm gonna take a look in. And I'm looking for any redness, any lesions, any foreign objects and obstructions, so any mucus or anything like that going on. Her mirrors are clear at this time, do not see any inflammation either, so looks good. The next thing we're gonna do is check to see if you can smell.
Okay.
Okay, so what I want you to do first is, cover one nostril, good, and close your eyes, and tell me what you smell.
Alcohol.
Good, good, okay. Now keep your eyes closed for me and cover the other nostril, and tell me what you smell. Okay, perfect, so she's able to smell, the different scents, from left to right. So cranial nerve 1, the olfactory is intact. Alright, do we need to check patency?
I think you just do it like
I don't know, that's not what
It looks good to me. Now we're
Yeah,
gonna,
that's it.
I'm actually gonna go ahead and do her ears next, since it's one of the easier ones, so, on inspection, the tissue is intact, she's got a couple piercings, so anytime a patient has piercings, you do wanna check around their piercings for any kind of, lesions or anything, and I don't see any deficit, any swelling, nothing going on. I did palpate already, noting that she has no tenderness, on touch, so we're good there. The next thing I'm gonna do is take my pen light and take a look in, okay? So now I'm gonna pull up and back for my adult patient here and take a look in, and I see no edema, no lesions, and no foreign objects in the ear, no excess cerumen. I'm gonna go to this side, again, pull up and back, take a look in.
No
Yeah.
way? No Legos?
No Legos, no peas, no mashed potatoes, and, no edema, no lesions. All the ear canal the external ear canal looks healthy, okay? I wanna check your hearing now, so I'm gonna have you turn towards Miss Amos, alright? And I'm gonna do the rub test on you, alright? So when I make a sound, please show me which side the sound is heard on, okay, by raising your hand. Good. Okay. Cranial nerve 8, the auditory, vestibular nerve is intact. You can use whatever name you want to use, but use one of the easier ones. Cranial nerve 8 is intact. Thank you. So now, yeah, good.
No, you get there.
So your paper does say the whisper test, and honestly, both of the whisper and the rub test check for gross hearing, okay? So in my group, as long as you do one of the two, you're getting a positive thumbs up with that, okay? So, either one. Okay, and then now let's check her mouth. So first thing I'm doing externally is looking at the lips. She's got really nice full lips. I like that. I need to get mine done like that. I'm making her embarrassed for sure now.
No, this is what she did to me.
But, so she's got nice full lips. They don't look edematous though. They don't look like they're swelling, so that's good, okay? Her skin is moist, there's no crusting, I do not see any lesions on her lips at all, so that's really good. Now, the next thing I'm gonna have you do is smile for me. Okay, good. And I'm looking at her beautiful white teeth now, so I'm looking at teeth, okay? And several times a day, that's probably why they're so white. Yeah.
They think it's weird to do it like 3 or 4 times a day. I'm like, you're weird.
Yeah.
Why would you not do it after you eat? That's gross.
Exactly.
When you have braces, you need to do it every time, right? So you get a good habit. Okay, so the next thing I'm gonna do is have you pull your lip down for me.
Bottom lip?
Yep, pull your bottom lip down. Oh, nicely done.
What did you say? What did you say?
That one.
What did you say? No, what did you say?
I've gotta know.
I need to know.
Is it appropriate?
No, I need
Is
to
it
know.
FU?
Immediately. Lucky? Question mark.
So,
It was St. Patty's Day. Lucky?
Tissues.
I did forget that,
Lucky.
to be honest, so, thank you.
Lucky,
I forgot.
That was a good one.
Yeah.
So tissues are intact, they're moist and pink. She has a deficit on there though, it's like, there's some discoloration. So, but what I'm really looking for is not necessarily, no, I know that was a word, so that's okay. If it was something discolored in that area, I would be concerned though, because oral cancers are real and they do happen in that area quite frequently. So knowing that it's not that, that makes me feel better. Questioning the word is another thing. Her gum lines are nice and healthy. They've got good vascular flow, and I do not see any bleeding or receding or anything going on at the gum line. So perfect. Okay. The next thing I'm gonna have you do is pull your lip out like that, and I'm just taking a look in. Okay, and do the other side. Perfect. So cheeks, the mucous membranes are pink and moist, just like they should be. I do not see any lesions there or any tumors or abnormalities going on. Now I'm gonna work my way towards the back of your throat, okay? So I'm gonna have you stick your tongue out at me and say, ah, okay? There you go, there you go. And her tonsils are, do you have tonsils?
Yeah.
Okay.
That's the other problem that she.
You did a good job by moving it. She moved it down.
That great job.
Okay, so she is able to stick her tongue out midline. Okay, so we know there's not a nerve deficit there, so cranial nerve 12, the hypoglossal, is intact so far, but we'll check it a little bit more in just a second. Looking at the back of the throat, her tonsils are very tiny, so like, I wouldn't even call them a +1, they're like way back there, okay? No redness, no edema, no striations or blisters in the back of the throat at all, no tonsil stones. The uvula, whenever she, let me do that one more time. Yeah. The uvula, whenever she says ah, rises with phonation, so the muscles are working well. At that point, I would say cranial nerve 10, the vagus, and cranial nerve, let's finish checking the cranial nerve 12. Okay, so I want you to, there you go. There you go. Okay, so left, right, and the roof of the mouth, okay? Cranial nerve 12, the hypoglossal is intact. So we've done a lot so far, right, already. So we've done cranial nerve 1, olfactory, cranial nerve 2, 3, 4, and 6. We've done cranial nerve 8, cranial nerve 10, and cranial nerve 12. So what are we missing? 5. All right, so this next one, you can either use the hand for sensation or one of the Q-tips, and I did bring a Q-tip over here. Okay, so I'm just going to have you close your eyes, okay, and I'm going to touch you on 3 spots on the east side of your face, and you let me know when you feel the touch. Perfect. Now I'm going to check for motor movement and any TMJ, so cracking or crepitus, okay? She's got a lip, minor. Yeah, she's got a little bit of, not cracking or crepitus, but you can feel her joint kind of move out of place a little bit when she opens her jaw. Do you have any pain or tenderness when you do that? Okay, so I did not feel any cracking or any popping, but it definitely kind of moves a little bit sideways whenever she opens her mouth. So that's assessing cranial nerve 5. Trigeminal nerve is intact. Now I'm going to have you do some facial movements for me for cranial nerve 7 since we skipped it. I want you to raise your eyebrows, squint them, okay? And I already checked her smile, and I know that both campuses raising together, but I'm going to have you frown this time. Okay, perfect. All right. So cranial nerve 7, the facial nerve is intact. Okay, nicely done, Neil.
Thank you.
Okay, now I'm going to move down to her neck and I'm gonna check her neck, okay? So I am looking on inspection for midline position. Everything looks good, I don't see any muscle deviations, any torticollitis or anything like that. I'm looking at her, yes, her trachea as she's swallowing is also midline, it's not deviated, okay? Do not see any obvious swelling or any issues there going on, okay? While I am doing this now, I'm gonna palpate, okay? The first thing I'm gonna do is have you tilt your head down a little bit for me and swallow. Okay. So on checking her thyroid, I do not feel the thyroid tissue move up and past my fingertips on swallow. And both sides move equally and symmetrically together, the muscles. So I would say cranial nerve 9 glossopharyngeal is intact, okay? I love that. Okay. So we're gonna do 11 with spinal accessory, checking the spine, having her doing the range of motion and all of that. The first thing I wanna know is, do you have any injuries? Any spinal injuries, any neck? Okay. Good. So we're gonna start at the head here, all right, and I'm just gonna have you look up and look down, and then to the side, and this side. Okay. Any pain or discomfort? Okay. Now I'm gonna have you push against me. Good. And against me. Good. Here. Push against me. And one more time. Good. Good. So, range of motion and strength of the head and neck are a 5 out of 5, all right? I'm gonna have you, stand up for me. All right. I'm just gonna put my hand on your shoulders, push against me. Nicely done, okay. So, I wanted to check her head and neck before I did this piece, but the spinal accessory, nerve, cranial nerve 11 is intact. She's able to kind of do, the movements for me. Now, while you're standing there, we might as well go ahead and do the range of motions. Okay, and that. So I'm gonna just have, go ahead and put your arms out for me. Good. And that's, go up. And then come down and back. Okay, good. Any pain or discomfort? No? Right, now put your arms like this. Any pain or discomfort when you do that? Okay. Pull against me. Okay, push against me. And relax your arms, and while I'm here, I'm just gonna touch, okay? And what I'm doing is I'm looking for any joint deformities, any swelling. And I don't see any, okay? And she had good, strength, good range of motion in the arms. So again, 5 out of 5. I did not circumduct with her, but if you wanna do this, you can. Okay. The next thing I'm gonna do is check your spine. Alright, so if you will bend forward for me. Okay. And as I'm looking on inspection, I don't see any deficits in her spine, but I'm gonna also go here. And I'm just going down the spine. It looks to be midline. Any pain or discomfort when you're doing that? No? Okay. Go ahead and stand up. So no scoliosis, no kyphosis, or no lordosis noted. And I'm gonna have you turn and turn. Any pain or discomfort? No? Okay. Spinal range of motion is intact. So now let's do your lower extremities, okay? So while we're standing here, how did you teach them for lower? This or this?
We didn't do that.
No.
I don't remember.
I know we did strength. I think wall gauges.
Yeah, I think we did like, just like doing this.
Okay.
I think I squatted.
Okay.
I don't remember that.
I think we did it during our like arm practice, but I don't think I did it in the factual.
Part of our checkoff.
Okay, so for hips, you wanna check hip mobility, okay? So if a patient is unstable on their feet, you might wanna have them hold on to something and have them just do like a 3-point access, okay? If they're able to apply pressure to one side, you can have them just rotate their hip out, okay? Any pain or discomfort? No. And then rotate your hip out. Any pain or discomfort? No. Good. Okay. So she's able to, rotate the hips, which is expected there. Now we're gonna check knees and ankles and feet for, range of motion. So with the knees, you can just have them do this. This is fine, okay? Cause it's extension, flexion, right? Okay?
Yeah, that way.
Yep, there you go. Now, have a seat for me. I'm gonna do some strength tests while I do the feet and everything, so we've checked range of motion with hips and knees. Now I'm gonna just put my hand here and have you push against me. Good. Push against me. Good. Push against me. Good. Push against me. Hold tight. Use the hamstring. There you go. Push. Sorry. There you go. Alright. She's strong. Alright, now I'm putting my hands, actually, can you lift your feet up for me? Good. Now point your toes. Good. So she has good range of motion in the ankles. Now push against me. Good. Push against me. Good. Nicely done. Alright. So all extremities have full range of motion and full strength. I did not feel any deficits from left to right, okay? So everything is intact. Alright, let's do the core. Okay. And then when I'm done, y'all can tell me what I forgot. Alright. So we're gonna move down now to the cardiac and respiratory stuff, okay? And the first thing I'm doing is I'm inspecting the chest wall. Do I see any deficits? No. She has a AP, so anterior to posterior diameter of 2 to 1. Her back is perfectly straight. No deficits there. I'm looking at the accessory muscles. She does not have any accessory muscle use, and her breathing is at a normal rate. Let's see. I'm gonna just grab your foot for a pulse here. Okay, respiratory rate is 16 and her, heart rate is about 68, okay? Is 68, I should say is 68, okay? So, and I do not see any accessory muscle use or any irregular depth, so rate, rhythm, and depth are appropriate for her right now, okay? My next assessment is going to be to auscultate. So I'm gonna do 8 on the front, 8 on the back with my diaphragm, okay? I start up here above the clavicle, so take a deep breath for me. Much better. Will you lift this arm for me? And then let me check this out. Perfect, let's do your back.
Oh my gosh, that deep breathing.
Now, I would get a fail on the making sure my patient's not moving enough, too much, cause she's up and down, so. Let's turn to you. Oh. so done. Okay. All lobes are clear to auscultation and do not hear any crackles, bronchi, or any adventitious sounds at all. So lungs sound wonderful. I am gonna have you turn towards the crowd again, so I'm gonna do, tactile fremitus and excursion now, so I'm looking for chest wall movement. I'm gonna put my hands on both sides of the spinal column and right at the base of the lungs, and take a deep breath for me. I'm looking for my, there you go, fingers to move apart, go again. Good. And the movement is symmetrical. When she takes deep breaths, one's not moving opposite of the other, any adverse problems there, so that's intact. Now I'm gonna check for tactile fremitus, and I'm gonna start at the top and work my way down, okay? When I put my hand on you, say 99 for me. So we're check, okay? Ready?
99. 99. 99. 99.
Perfect. I feel vibration, it's more intense at the top, and as I move down, it does diminish, but that's expected. So no deficits there, no dullness on vibration either. So totally intact. Make sure I'm doing everything here. Okay, turn around and we'll do heart. All right. I'm actually gonna do carotids and heart together here. So, because they are central vessels, we should always probably check them together. So the first thing I'm doing is inspecting. I don't see any abnormal pulsations going on in the chest wall. Breathing looks good. There's nothing really that's making me see that there's any issues, except for she's tired. Okay, so on inspection, chest wall is effortless with breaths. I don't see any pulsating arteries or anything like that going on. Now I'm going to palpate for heave and thrill. Okay, so again, I'm going to use this part of my hand, and I'm going right here, second intercostal space where my pulmonic artery is, and I'm just placing my hand there to feel for vibration. And I do not feel any, which is good. Now, the other one is the mitral valve area. So here you want to just put your hand here and feel for vibration, okay? So when it talks about the pulsations, chest wall pulsations, that's what we're doing. Heave and thrill, okay? This is what we're looking for. And again, no abnormal pulsations, so we're good. The next thing I'm gonna do is check for carotids, then I'm gonna do the lung sounds, okay? So as she's standing up, I'm just gonna I'm gonna touch first, okay? So one at a time. Breathe. Okay. Carotids are weak. Were you too, or she felt that already?
I don't know if we,
I don't think we
I
did
mean,
after
we-
this, yeah.
we did do carotids, but
Okay.
I don't remember.
Oh,
being
there we
weak.
go. It's deep. Her carotid is underneath her sternocleidomastoid.
Muscular.
Yeah. Yeah. I didn't feel it at first, but when she moved her head, that's where it's at. So you see how I'm having to do my fingers instead of just doing this? I had to feel it. That's because it's behind this muscle here. So if I was to rate the pulsation, she's got at least a 2+, so it's nice. It's a good perfusion rate, so very nicely. So now I'm just gonna listen, okay, and I'll have you have a seat. So I'm gonna turn it to the bell side, okay? I'm gonna have you take a deep breath, exhale, and hold it, okay? Okay, breathe. She's got some pretty strong carotids. They're definitely, that's why I was like, ooh. So she has a good S1, S2 that I can hear in the carotids, so we're good there. Our next priority assessment piece is to do the valves. So you're gonna do them with the diaphragm and the valve, okay? So as we move through, I'm gonna say the names of each valve as I'm going over them, okay? So second intercostal space, right of the sternum is your aortic. Second intercostal left of the sternum is your pulmonic. Okay, I'm just gonna come down one to Erb's point, which is your third intercostal space. I need to go back up. Okay, and then I'm gonna come down one more, fourth intercostal space. This is tricuspid. Good job. Okay, and then I'm gonna come down one more for the fifth intercostal, and you would lift, okay? And right here in this area, I'm gonna do on both sides. And then a PMI is gonna be off to the lateral point, okay? You will not have to auscultate that, but I do want you to palpate for any, vibration there, okay? So aortic, pulmonic, Erb's point, tricuspid, mitral. We're done with the cardiac assessment, all right? Now, since I've already done the cardiac and respiratory assessment, I am actually gonna go ahead and complete my pulses, since I'm kinda in that role, okay? So I'm gonna check for my brachial. And we're gonna do them symmetrically on both sides. Okay. Radio. The next system. There you go. Okay, then we're not gonna have you check the femorals, but femorals is right there. Then popliteal, we're going in. These are deep, so they may be hard to find, just show that you know where they're at. Okay? Then I'm gonna go posterior tibial, right behind the ankle. And then dorsalis pedis, right between the great toe and the one next to it, just above. Okay? So all the pulses are completed. Just wanna make sure, let's do your abdomen.
Well, I don't wanna put you on this stretcher.
You're just gonna like lean off.
Yeah, you can just leave.
Like lean backwards, like
Go
this?
ahead. Yep.
Here, I'll put your pillow underneath.
Okay. Okay, now what I'm gonna do, her abdomen, I'm just working down the body, system by system, okay? And like I said, are y'all grading me? Cause I think I forgot something. What did I forget?
Lymph nodes, sinuses.
Okay.
Oh.
The sinuses, okay, I'll go back. Okay. So, I knew the lymph nodes, I was going through those last, but I forgot about sinuses. Okay, so abdomen, looking for contour, right? Shape, size, contour. So her abdomen is flat. I don't see any bulges or any deformities going on, and she doesn't appear to have any ascites or any issues like that. So, and we would look at skin to make sure there was no extravascular deformities or anything like that going on in the stomach either. After I inspect, I'm gonna auscultate. And I'm gonna start at the right lower quadrant. Do you have any pain or discomfort? When's the last time you had a bowel movement?
Yesterday.
Okay, so I do hear bowel sounds in all four quadrants, and I would say they're normal active. How was your bowel movement yesterday?
I came up with a woman quick.
Okay, so, the better question is, was it formed, or did you have any problems, like with diarrhea? Okay, so it was normal for you?
Yes, it was
Okay, good. And when's the last time you urinated?
Like 2 hours ago?
Okay, and that again was normal for you? Okay, and no smell, no problems burning, anything like that? Perfect, okay. The last thing I'm gonna do is palpate, you said you had no pain, right? Okay, so I'm gonna do a 1 to 2 centimeter palpation. The light palpation, I'm gonna start in the same quadrant, and I'm feeling for any, problems. And I should have listened to your aorta first, but we'll go back to that, okay. I don't feel any, swelling or any bulging, so for like hernias or anything like that. I'm checking around their belly button also. No deformities. Let me go back to this. I do not see any aortic pulsations, okay? And I'm going to listen right here. That is not what I'm supposed to be hearing. So nice, aortic pulsation, just normal. I don't see any, heightened or hyper sounds, so we're good, okay? Okay, have you seen this today? All right, so I will go back to lymph nodes and, sinuses in a few minutes, okay? Now, let's do some of the other neuro stuff that needs to be checked off before I go back up there, okay? So I'm gonna have you hand me your hand here. Okay, close your eyes for me. And I'm gonna draw something in your hand and tell me what I'm drawing.
An A.
Perfect. Let me see the other one, okay? And tell me what I'm drawing.
I see it.
Perfect, okay. I'm gonna grip, get you to grip and yes, squeeze, there you go, perfect. Alright, because I forgot to do that a while ago. Go ahead and stand up for me. Oh, my hands, my gloves are breaking. We're gonna do a gait and balance. Alright, so we did the range of motion on all the extremities, we've done the pulses on all the extremities, she's shown strength on all the extremities. Now, I'm just gonna check for cerebellar dysfunction, so I'm gonna have you stand right here.
This way?
Yep, turn around, and I'm gonna have you take 3 steps away from me, and I'm watching her gait for any type of wobble, any, slushing of the feet, anything like that. Her gait looks intact, turn around. No wobbling, come on back 3, okay, and stop. Now, put your hands at your side and close your eyes. And what we're doing is we're looking for any wobbling, instability and standing in one place. And she does not have it, so we have a negative Romberg's, okay? And then, go ahead and sit down for a second, because I feel like I'm forgetting something.
Did I need to do this thing?
Oh, that's what it is. Okay, awesome. I wanna have you do this real quick, but do it on both sides. Perfect, alright. And then touch your nose. Good. Close your eyes for me. Now, one arm at a time. There you go. Nicely done. Okay. What else, you guys? Sharp and dull. Sit down for a
How
while.
can you tell?
I didn't drink today. That was the question.
Yeah.
Reflexes and sharp and dull. Okay. All right. Let's do this one real quick, and then I'll go back to reflexes. Okay. So, this is a lot of stuff. All right. So sharp and dull, we're just gonna have our patient close their eyes. All right. And then I'm going to touch you with my object here. And then once I touch you, tell me if it feels sharp or dull. Okay? Perfect. So when we do reflexes, you wanna make sure that your patient's relaxed, and so sometimes we'll have them do like this or whatever if they're super anxious. We don't want them helping us. So, for the tricep reflex, I'm gonna get up here with you for a second. I'm gonna have her just kind of relax here, and then I'm looking for right between where that funny bone area is at, okay? And if you really do this, you're not sitting where the arm is gonna, just in case, but you wanna get them right here. And she did just a tiny bit. You see it move? Okay, did you feel it?
Kind of.
Yeah. I didn't push her
I
hard.
don't really relax very easily.
I know, it's right here. Her back is like
Very tense.
okay. So again, right here. The hand moved that one. Sorry. Oh, you see her hand?
Wrist kind of flipped.
The odd reflex.
That's not a right reflex.
It's a reflex at
It
all.
should be like, do you see her hand?
We think she's just.
How do you go back?
I don't know.
Yeah,
That would
that's
die now.
interesting. I've never seen that before.
My
Okay.
my legs don't do it.
She might be able to get it.
Yeah.
So,
We'll see.
if you've had a back injury and stuff, sometimes it can affect it, but, so right here where her watch is really where I wanna go with this one, so I can take it off. We're gonna, just kind of relax her arm here, and then I'm gonna just, there we go. Oh, you did it good. And then on the inside, right here, just gonna try to see if I get a reflex there, good job. Alright, and I'm gonna come over here, same thing, just relax for me and hang loose. Good, just a little bit. Now, so that was radial, okay, and, so brachial, radial, reflexes, popliteal, coming right here, right?
I'm telling you, you can get nothing out of her.
Wow.
I demonstrated it on her and it was like,
Oh,
Oh,
yeah.
I got it.
you gotta smack it. We made her laugh, we loosened her up.
Yeah, she's a little tense, that's
Yeah.
for sure. Just relax. Yeah, she's a tough cookie. Alright, she's got good reflexes, so if I was going to measure the reflex, I would say that all of her reflexes are a 2+, they are intact. She does not have any neurological deficits that I can tell so far. I am gonna come down and do Babinski's, so typically when we do Babinski's, we're looking for toe reflex. She has her shoes on. So I'm not gonna be able to show you that, but you're gonna do like a question mark, thank you, on the bottom of the foot. So you're gonna, at the ball of the foot is where you're gonna start, and you're just gonna draw that question mark on the side of it. What should happen when we do Babinski's is that they should curl their toes in, okay, that's a normal reaction. Babies though, up until about 2 years old, they will flare their toes. That's normal for them, okay? They'll like try to get away from it. Adults, we do this. If you see an adult flare their toes, we got problems. Okay, there's something neurologically not intact. All right, so reflexes are done. I feel like I'm missing a whole bunch of stuff.
Lymph nodes?
Lymph nodes and sinuses, is that it?
And the eye. Are we gonna do the eye test where we look at the chart or no?
Just a confrontation for that, so either one.
Okay.
Okay, whatever you choose is fine with me. I'm gonna have it there as a reminder.
Okay.
Okay, so since I did touch her feet, I am gonna change my gloves so that I can finish with sinuses.
And visual
lymph nodes.
acuity. Visual acuity.
Is it on there too? Yeah.
Hmm.
Okay. I thought it
It's
was
already
either
been
or.
50 minutes.
It says visual acuity are in here.
Oh, accommodation, so we're not gonna be able to do near. I mean, it's not really necessary, but we can do far with the big, okay? And I'll do it with her with the small handheld one. So before so I'm gonna backtrack because I forgot, sinuses, alright, when I was doing the nose. So when we're doing the nose, we should be doing sinuses too, and I'm just going to palpate, is that okay? So let me know if you have any pain or tenderness. No? So no edema, no pain, no tenderness, that looks good. Now I'm going to do her lymph nodes for you. Right, I'm gonna start in the back, and remember the occipital nodes are right at the base of the skull. Circular motion with my fingertips, any pain or discomfort? No, and I don't feel any palpable nodes. Now I'm gonna come right here, and this is the posterior auricle, preauricle, tonsillar, okay, submandibular, okay, submental. So deep cervical is up underneath this muscle, okay? Okay, posterior cervical. Okay, deep cervical, yeah, and anterior cervical. And then supraclavicular.
What was the other thing that was wrong with you? Your reflex.
So I do not feel any palpable lymph nodes, everything looks good there.
I have half a thyroid if anyone wants to
How are you feeling?
figure that out.
Okay, did I check everything?
I think so.
Did I check everything? Yeah?
We couldn't,
What?
you have to do the CV.
Oh,
here.
is it on there?
It's not anymore.
If it's not on there, you don't have to do it, but yeah, so CDA would be included in the GI assessment when we do GI, so doing, right? Do you have any questions for me? Okay. Thank you for being a good participant.
Of course.
Alright. And I would take my gloves off, wash my hands, uncover privacy.